если можно, один вопрос к Джефу и один вопрос к Анне. Только если очень быстро, и если они есть. Микрофоны вы видите, 3, 4, 2. Вот у нас подходит ко второму микрофону. Пожалуйста, адресуйте кому ваш вопрос. Спасибо.
My name is Wanda Nowicka. I am from Astra, Central and Eastern European Women's Network for Sexual and Reproductive Health and Rights. I have a question to two presenters, in fact. While looking at the presentations, we didn't hear anything about women and gender issues and HIV pandemic. We know very well that the HIV pandemic in our region is growing very fast among women, and currently almost 45% of women are infected and have contracted infection, especially young women. And I wonder whether you identify this as a problem, that gender inequalities and unequal status of women in our societies feed the transmission, and whether you are doing something to also address spreading infection among women. Thank you very much.
Thank you for the question, and I apologize for having only 20 minutes to cover all the aspects of both the epidemic and the prevention itself, so it was quite a task, and I apologize for not mentioning it, but it's simply because of the time constraints. But you are absolutely right, we're seeing indeed quite a feminization in the region, especially in the Eastern European and Central Asian region. Although I must say that for some countries it's hard to say where the data are coming from and how to interpret those. But you are right, at least I can say in the countries where I know better and I have the information on, what is really alarming lately is that we see increasing issues around both within the community of drug users, for instance. We see much higher level of stigma discrimination towards female drug users than towards males. There are different data, I don't want to go into much details. Secondly, it is pretty much often non-drug using female sexual partners of male drug users that we see sexual transmission in. There are much more adolescent girls who are reported to have HIV, etc. So it's definitely an issue, and it is essential that gender context is brought into this, and it's not only Africa and Asia. In our country there are definitely inequalities across quite many countries in the region, in Central Asia especially, so I'd be happy to talk to you later on.
Спасибо большое за вопрос и за ответ. У нас есть возможность второй вопрос услышать.
Thank you very much. Good morning. My name is Srđan Matić. I'm from WHO Regional Office for Europe. It's more a comment for both speakers. I would have expected more attention to the issue of treatment access in Eastern Europe. As it was shown by Jeff, I mean, this is the worst performance of a region of all parts of the world. And I don't think it's an issue of clinical management as much as it is about some basic obstacles to access to treatment, either through inavailability of treatment or through obstacles for people living with HIV to access what is available. And also there were some interesting sessions in this conference showing the modeling data on the impact of universal access to ARVs on the prevention, and I think that in this part of the world we should also pay attention to that dimension of it. Thank you.
Actually, thank you for that comment, because I was also going to turn to you, Jeff. I was very surprised by this slide saying that the issue is not really one of access for those who have been diagnosed. That's certainly not true in Eastern Europe for people who use drugs. So could you please comment?
Yes, thank you, Michelle. I quoted the ECDC report, the special report from the Dublin Declaration, but I also added that that the enabling environments are lacking for drug users, for men who have sex with men, for sex workers. So it's actually not as simple, I think, as it was stated in the report itself. So I'm sorry if that didn't come across clearly. I mean, there are multiple aspects to accessing treatment. One is, of course, knowing your status. Another is being able to come back to the center aware of your status and access treatment given the reason you got HIV in the first place. Because of the discrimination against injecting drug users, it doesn't always help to know you're HIV positive, and that's why I added the words of Anne Sarang that from Monday that what is the incentive given this discrimination to go to a healthcare center in the first place, and I would add even to return knowing your status for treatment if you're going to be discriminated against.
Спасибо большое за комментарии и